Did you know that a Medicare benefit millions of seniors now rely on could quietly disappear as early as next year? I'm talking about telehealth, those simple doctor visits you can do from home, without driving, without sitting in a waiting room, and without risking your health. Before we go any further, comment your name and state below. I'd love to see who's watching and benefiting from these videos, and it also helps this information reach more seniors who need it. Let me start with a story that might feel familiar. Margaret is 72 years old. She lives in a small town, about 40 minutes from the nearest hospital. She has arthritis in her knees and doesn't drive much anymore. Over the last few years, telehealth has been a lifeline for her. She checks in with her primary doctor by video. She manages her blood pressure medications over the phone. She even talks to a specialist without leaving her living room. For Margaret, telehealth isn't a nice extra. It's how she stays healthy and independent. Now imagine waking up one morning and being told that those visits might not be covered anymore. That's the reality millions of Medicare beneficiaries could be facing if Congress doesn't act soon. During the COVID pandemic, Medicare temporarily expanded telehealth coverage. Suddenly, seniors could see doctors from home, even if they lived in rural areas. Audio-only visits were allowed. Specialists were easier to access. Mental health care became more reachable. And for many seniors, this wasn't just convenient, it was safer. But here's the part most people don't realize. Those expanded telehealth rules were never meant to be permanent. They were extended year by year as emergency measures. And right now, those extensions are set to expire. If nothing changes, Medicare's telehealth coverage could roll back to much more limited rules. That means fewer eligible visits, fewer approved locations, and fewer options for care from home. This affects both original Medicare and Medicare Advantage, although in slightly different ways. Let's slow this down and make it very clear, because this is where confusion starts. Original Medicare follows strict federal rules. When telehealth rules expire, original Medicare would once again limit coverage mostly to rural areas, and often require seniors to be physically present at a medical facility rather than at home. Many audio-only visits could disappear. Some types of virtual check-ins may no longer be paid for at all. Medicare Advantage plans, on the other hand, have more flexibility. Many plans added telehealth as an extra benefit. But here's the important part, they are not required to keep it if federal rules change. Plans can modify benefits every year. And if telehealth becomes more expensive or less supported, some plans may reduce or remove it. So no matter which type of Medicare you have, this issue matters to you. Now let's talk numbers, because this isn't a small issue. More than 67 million Americans are on Medicare. A huge percentage of them use telehealth at least once in the past few years. For mental health visits alone, telehealth usage exploded among seniors. Chronic condition management, follow-ups, medication reviews, all of these shifted online. Doctors adapted. Clinics invested in technology. Seniors learned how to use smartphones and tablets, sometimes with help from grandchildren. Telehealth became normal. And that's why this potential rollback feels so jarring. From Medicare's perspective, telehealth was meant to be a temporary solution during an emergency. From seniors' perspective, it became a permanent improvement in quality of life. This is where Congress comes in. Lawmakers are currently debating whether to extend Medicare's telehealth flexibilities again, make them permanent, or allow them to expire. Nothing is guaranteed. These decisions often get bundled into larger budget negotiations, which means telehealth can become a bargaining chip rather than a priority. And that uncertainty is exactly why seniors need to pay attention right now. Let me be very clear here, this video is not meant to scare you. It's meant to prepare you. Because the worst thing you can do with Medicare is assume that benefits will always stay the same. We've seen this pattern before. Benefits get expanded. People rely on them. Then rules change quietly, and seniors find out only after a claim gets denied. Imagine calling your doctor for a routine telehealth appointment next year and being told, "Sorry, Medicare no longer covers this visit." That's not a hypothetical. That's a real possibility if these rules aren't extended. Now let's talk about Medicare Advantage specifically, because many people assume Advantage plans automatically protect them from changes like this. Sometimes they do. Sometimes they don't. Many Medicare Advantage plans advertise telehealth heavily. Some offer $0 virtual visits. Some include mental health counseling from home. These benefits are attractive, and for good reason. But remember this one key rule: Medicare Advantage benefits can change every year. Plans decide what they offer based on costs, federal guidance, and risk. If telehealth coverage becomes more expensive for plans, or if regulations change, they may reduce availability, add restrictions, or require different copays. That doesn't mean telehealth will disappear overnight from every Advantage plan. But it does mean you cannot assume today's benefits will exist tomorrow. This is why reviewing your plan every year during annual enrollment is so important, especially heading into 2026. Another thing many seniors don't realize is how telehealth connects to other Medicare changes. For example, provider shortages are getting worse, especially in rural areas. Telehealth helps fill those gaps. If telehealth access shrinks, wait times could increase. Travel costs could go up. Care could be delayed. That leads to another issue: out-of-pocket costs. If telehealth goes away, some seniors may need more in-person visits. That can mean transportation expenses, caregiver costs, and higher co-insurance. What feels like a small policy change can turn into a real financial burden. Now let's talk briefly about dental, vision, and hearing benefits, because many of you ask how this connects. Original Medicare still does not cover routine dental, vision, or hearing care. Medicare Advantage plans often include them. Telehealth has played a role here too, especially for vision screenings, follow-ups, and consultations. In 2026, Medicare Advantage plans are expected to continue emphasizing extra benefits like dental and vision to stay competitive. But plans may also shift resources. If telehealth becomes harder to offer, some plans may rebalance benefits. That's why it's important to look at the full picture, not just one benefit in isolation. Here's the payoff part of this video: what you should actually do. First, stay informed. Don't rely on headlines alone. Telehealth rules can change quietly. Follow updates from Medicare, and pay attention during enrollment periods. Second, talk to your doctor. Ask them how telehealth changes might affect your care. Some providers may offer cash pay virtual visits if Medicare coverage changes. Knowing this ahead of time helps you plan. Third, review your Medicare plan every year. Whether you're on Original Medicare or Medicare Advantage, don't assume your benefits are locked in. Look specifically at telehealth coverage in your annual notice of change. Fourth, if telehealth is essential to you, and for many seniors it is, prioritize plans and providers that clearly support it. And finally, remember this: Medicare decisions are not just about today. They're about protecting your access to care tomorrow. Telehealth has proven its value. Seniors use it. Doctors support it. The question isn't whether it works. The question is whether lawmakers will make it permanent. Until that decision is made, awareness is your best protection. If you've used telehealth through Medicare, or if losing it would impact you, comment below and share your experience. These stories matter, and they help others realize they're not alone. And as always, this video is for educational purposes only. I'm not a licensed insurance agent, and Medicare rules can change. Always check official Medicare sources or speak with a qualified professional before making decisions. If this video helped you understand what's happening with Medicare telehealth, please like it, share it with someone who might need it, and subscribe for future updates. Medicare changes fast, and my goal is to help you stay one step ahead. calmly, clearly, and without the confusion.